Welcome back to Let's Address This with Qasim Rashid. I'm excited about our guest this week. It's someone who I've never had on before and someone who's running an exciting campaign for governor of Maine, which, if you've been following Maine politics, you've probably heard about the Plattner campaign for U.S. Senate. But in my view, this campaign for governor is just as exciting and deserves just as much attention. Nirav Shah is running for governor of the state of Maine, and he joins us today. Nirav, thanks for giving us a few minutes of your time.
Hey, thank you so much. Excited to be on.
I gotta say, as a fellow South Asian myself, I could see a South Asian running for governor in like here in Illinois, where I live, or maybe even in like Maryland or even California. But Maine would not be on my bingo card. How does that happen?
Well, I moved to Maine a number of years ago, having lived in and worked in Chicago and Illinois for a long time. I had the opportunity to move out here and run the state health department. That was a job that I had in Illinois. I came out here under Governor Mills and worked at the state health department, particularly during COVID, when I got to interact with, engage with, and care for the health of Mainers. I then went and served in the Biden administration as the number 2 official at the US CDC, the principal deputy director. I came back to Maine and was approached to consider running. I was unsure at first, but after I saw the destruction that Donald Trump and RFK were bringing to many of the world's most cherished institutions, like the US CDC, USAID, I felt like I could not sit on the sidelines anymore. Now, I acknowledge that Maine is not the first place you might think of when you think of South Asians or other minorities running for public office. But I think there's an important point there, which is if we think about South Asians or others running for office only in the places where they are populous, then we're not really talking about real representation.
Yeah.
The project to have a broader array of elected officials only works if we're winning not just in Texas, California, Illinois, but also when we're winning in places like Maine.
Yeah, I mean, I think that's the beauty of the American experiment, right? That we're not a nation founded under some kind of religious theocracy. Where this whole experiment is a democratic republic where there is no religious test, there's no racial test. You are pursuing on merit, and we just want a level and equal playing field. And I think you're exemplifying that here in Maine as well.
That's exactly right. I mean, this is the essence of a merit-based system at its finest.
Yeah, I love that. And given the state of our public health or lack thereof, it's especially prudent that we have a public health expert like you running for office. I'm a parent. I have, my wife and I have 3 amazing children, and we're mortified to see measles break out in South Carolina. We're mortified to see these continued rates of chicken pox kind of emerging because people are having chicken pox parties. It's absurd. What do you see as the remedy to this, aside from getting RFK out of that seat and electing folks that believe in science? The question I have is a little bit different. We could vote out Trump in 28. We can obviously remove RFK. We can put a competent leader in there, but the damage done to our sciences, the damage done to our trust in public health institutions. As governor, how do you restore that trust to where it once was?
Great. Well, you are correct that the damage that has been done to our nation's healthcare and public health systems will take years, if not longer, to rebuild. The departures, things of that nature, will take years and years and years to reverse course. So, what can we do in the interim? Well, that's part of the reason I'm running for governor in particular. It will only be through state governments and the governors who lead them where our health, our safety, our welfare, and our rights will be protected. And so you ask, what can we do? The first thing we can do is elect leaders, in particular governors, who lead with science, who look at data before making decisions, who run on a platform of progressive pragmatism rather than knee-jerk ideology. Those are the ways in which we will stay safe, in the ways in which our rights will be protected. That is part of what I am intending to do as when I am governor here in Maine. It's equal parts restoring the balance of power so that notwithstanding the worst excesses of the Trump administration, in places like Maine, we still have sanity. But it's also about continuing along progress. continuing along with imperatives like universal health care,
Hmm.
protecting the environment, making sure that our children are educated and that housing and energy are affordable. So we can do both, but it starts at the top with strong, capable leadership. And that's why I'm running for governor.
And there's something to be said about the work done under the Biden administration to improve public health, especially as he inherited a disaster with COVID. And you know, a lot of folks forgot about this, but part of the reason why COVID spread so rapidly in the United States is because a lot of the safety protocols enacted under the Obama administration were immediately dismantled under the Trump administration. The kind of the red flag signs. Can you talk a little bit about that? Because I think people seem to think that COVID just magically appeared out of nowhere, but a big part of it was ignoring the signs that something is happening. And a lot of public health is not just about cure, but it's about prevention. When those preventative methods are discarded, then we're in trouble. And I don't know if that story's been told effectively enough.
It's a great question, Qasim. A core tenet of public health is that what is predictable is preventable.
Mm.
If we can predict that something is likely to happen, we should simultaneously be able to take steps to prevent it from materializing. And that is the entire approach of public health. Head trauma is predictable if you don't wear a helmet. So we should prevent it by doing so. The same applies with pandemics. As you noted, during the first Trump administration, there were key structural steps and changes that were made. For example, dismantling a key piece of the pandemic preparedness infrastructure at the White House on the National Security Council and taking it offline, dismantling pieces of the CDC. The Biden administration restored those. And as a result, when I was at the US CDC, we felt capable, we felt confident that if another type of pandemic were to emerge in another part of the world, that we would be able to spot it, we would be able to cooperate with that country, and we would have the best shot at preventing it from spreading and coming to the US. The destruction of those institutions means that the United States is not prepared for the next pandemic right now. That is a terrifying
Yeah.
thought. It
Horrifying.
also means that the information that is on the US CDC's website, particularly as it relates to infectious diseases, is not trustworthy or reliable. That is a stunning admission
Yeah.
from the just recently departed deputy director, as I am.
Mhm.
But yet, that's where we are. My point, my view, Qasim, is that the entire agenda of the Trump administration and RFK is to make America healthier again. They have done the exact opposite.
Yeah. Yeah, it sounds like a great slogan in principle, but when you kind of look under the hood, you realize it's just a veneer, and what's happening in the underbelly is far worse. What should parents be doing to keep our kids safe, especially when the whole point of vaccines is sure it's the individual protection, but they don't actually work when only a few people get them. You need collective, community engagement to kind of snuff out a virus or a disease. What are some of the additional steps that parents should be taking right now to make sure that not only are we safe, but more importantly, our children are safe from acquiring some kind of weird disease reviving after 25 years?
Love that question, Kasim, because again, it gets to the heart of public health. Public health is a group project.
Yes.
Community is a group project.
Yeah.
And so none of us is going to achieve true health on our own. Health, public health, and community are a group project. And so parents are a key piece of that. Here are three tactical things that parents can do right now. Number one is make sure you are in regular communication with your child's pediatrician to make sure your child and children are up to date on all of the American Academy of Pediatrics' vaccines. Not the CDC schedule, which is a sad thing to say, but the AAP schedule of recommended vaccines. Number two, make sure that when you are seeking out information for your child's health, your family's health, you are going to reliable sources. Again, the American Academy of Pediatrics is where I would go in these times, not the US CDC. And then
Mm.
number three, I know that parents are busy right now, but there is always a good time. Now is always a good time to make your voice heard to all of your elected officials. Sometimes when we advocate to our elected officials, we only speak to our congressional delegation.
Yeah.
My view is that you should be communicating with every level of elected official, local, state, and federal, to share your views on public health, ICE raids, whatever the case may be. When folks are silent, their view is it is viewed as that they do not have a view. And there's an
Yeah.
old adage in politics, if you're not at the table, you're on the
Yeah.
table.
That's
And
right.
so you've got to make your voices heard.
So if you're just tuning in, we're speaking with Nirav Shah, who's running for governor in the state of Maine. Comes with decades and decades of national and global leadership in public health. Let's talk about the role that governors are going to play after midterms, because that's when your election is, and hopefully you win. We have all the good stuff. We've got a federal administration who is effectively waging an all-out assault on state governments. We're seeing the attacks on Minnesota. We're seeing his attempts to send the National Guard to different states. This surge in these ICE fascists, I call them fascists because that's what they are, in the way they target people without due process, kill innocent people by shooting them in the face. I'm quite angry about this. What role do you see governors playing in protecting people from this federal onslaught and overreach?
Great. Uh, Leadership always matters, but leadership particularly matters in this moment because it will be through governors and the state governments they lead where we stay safe and where our rights are protected and vindicated. Here are a few ways in which governors have outsized importance right now and into the future. We already just talked about public health. Right. The Trump administration changed the vaccine schedule in a completely unscientific way. It will
Yeah.
only be governors who stand up and say, not in Maine. Here in Maine, we're still going to do things the right way. Mentioning the ICE raids. There are very tactical, legal, and administrative things that governors can do to make ICE's job that much harder. For example, governors can prohibit cooperation between law enforcement, local
Hmm.
law enforcement, and federal officials. Governors can make it such that local and county jails cannot house ICE detainees. They can make it harder for ICE to build temporary facilities. Governors can put into place speed bumps that protect our rights. One or two other areas. Environmental protection. The Trump administration has picked up its ball and gone home. It will be up to governors to keep our environment, our woods, and our waterways safe and accessible. The last one that's top of mind for me, particularly here in Maine, is on climate related disasters. A lot of states have not had significant disasters, but as the world warms, they are becoming more likely. Here in Maine, floods, wildfires, we are starting to see them. FEMA has in fact said that when a disaster happens, states are on their own. What that translates to is that governors must be ready to lead at a moment's notice. We need to have governors who are comfortable in crises and comfortable with tough decisions and know how to communicate them. Those are the skills that I've built up. That's what I've done before, and that's what I'm ready to do again.
And building on that, when you talk about healthcare, I think we're aligned that healthcare is a human right, and we need to guarantee healthcare is a human right. What roles do you see governors playing, especially as we're going, as you're listening to this, we're seeing the Republicans continue to crush ACA subsidies, and on one hand, it's cruel and horrific and barbaric because they know it's going to price people out of healthcare, it's going to increase the death count, and simultaneously, I think the second fact that's true is that the ACA subsidies are a band-aid solution. And Republicans don't have a solution, so I don't want to be like, oh, they're doing it for a noble cause. No, they're doing it because they're cruel and it's horrific punishment. And corporate Democrats seem to lean on these ACA subsidies, ignoring the elephant in the room, which is just make healthcare a human right. Have our tax dollars pay for our healthcare, so we don't have to have this stupid fiasco with ACA subsidies. The federal government doesn't seem to get on board. What strategies exist in your mind, and can you foresee a system where governors band together and say, "Hey, we are going to have a public option for these states, and if you live in these states, you'll be able to buy into the public option."
Great. As far as I can tell, the Republicans' healthcare plan is don't get sick. And
Yes.
if you do get sick, be rich.
Yes.
I mean, that's as far as I can see what the contours of their
Accurate.
plan are.
Yep.
And again, in this moment of abandonment, it will be up to governors to lead the way. There are a number of options to expand and enhance healthcare coverage. They all start by my lights with our North Star, which is universal healthcare access and coverage
Yes.
across the United States. And
Love
we
it.
must at least agree and align on that value. And I think we all do, at least on the Democratic side. So then
Yes.
how do we get there? There are different options. There are different pathways. There's a lot of interest in a public option. It's a great approach. It's a first step, not the last step, because that's still insurance That's
Hmm.
not universal free care.
Right.
Another option is just to do that. States can start with taking toes in the water toward universal care. For example, universal primary care or universal pediatric care, not
Yeah.
a public option, guaranteed care. There are different approaches. They will be different for each state. Here in Maine, we're a smaller state. That gives us some benefits, but it also has some downsides. There will not be one single best approach for any state, but what matters is that we start moving in that direction, not just on coverage, but on drug prices as well. Both of which are the ways in which people experience high costs that ultimately lead to medical bankruptcies.
I've told the story before, but my wife and I have our youngest is our daughter who has an incurable disease that's chronic, and if it's not treated, it's fatal. The medication for it that exists, the biologics that she needs to survive, costs about $250,000 a year. I don't know about you, but most Americans don't have $250,000 a year lying around. Insurance company denied us 13 times. 13 times they denied us. And worse, the medication that they recommended that you take, that our double board certified physician was saying, this is bad news. The study is showing that this has adverse effects, that it works for the first few months, but then it has detrimental long term effects. God bless my wife for many reasons. And one of them is she resisted it and said to the insurance company, no, we're not going to do this because our doctor is telling us no. And lo and behold, the further studies have shown that as well. Um, all this is to point out the question that, do you see a future where there's accountability for these insurance companies who are prioritizing profit over healthcare, knowing full well that this will kill people, but it'll make us money? I mean, we have accountability for tobacco companies. We have accountability for big oil coming soon. Why can't we hold health insurance companies accountable the same way for pushing policies that they know will kill people, but they do it anyway because it makes them money?
Well, you're absolutely right. There is an inherent conflict of interest, an unethical conflict of interest between insurance companies and their mandate to both return profits to shareholders and simultaneously provide health care.
Yeah.
It seems like for most Americans, the way insurance companies work is I give you a ton of money, and then every now and then you dole out a little bit of health care to me.
Yeah.
And that is absolutely unethical. And every single American knows that the insurance companies are part, if not the sole reason for much of our healthcare woes.
Yes.
Now, first, let me just express I'm glad your daughter is doing well. And more importantly, I'm glad you're advocating. It should not have to be the case, though. Right?
Yeah.
That's not how the system should work.
Yeah.
It shouldn't be a full-time job for a parent to have to advocate in order to get their child
Yes.
essential medication. That is another sign of our system being broken. What can we do? Accountability is a part of it. Whether that accountability proceeds through the judicial system, as tobacco and oil companies has,
Yeah.
or perhaps more likely, whether it proceeds through the regulatory system. Uh, Either way, it will be states and governors who lead that charge. As governor, one of the approaches that I will take is really to clamp down on these maddening and unethical practices like prior authorization,
Yes.
non-experts telling expert physicians how to practice medicine, not for patient benefit, but for profit. All of those can and will be regulated at the state level under my administration, putting caps on premiums, caps on deductibles, caps on out-of-pocket expenditures. Insurance companies are already making plenty of money. It's time they do what is best for the community. Again, community is a group project, and this is how we get there.
And all this, and if you're just tuning in, we're speaking with Nirav Shah, running for governor in the great state of Maine. And I'm going to ask you in a minute to share your website and how folks can get involved with the campaign. But I want to continue this theme because all of this ties into this core principle of affordability. It's becoming unaffordable. It's become unaffordable in America. More than 60% of Americans can't make ends meet, which is just an astronomical number. That's more than 200 million people who can't afford to live in the United States but live here. Let's talk about that aspect of it. What do you see as your top two or three priorities to turn the tide? In New York City, we see Zoran Mamdani already implement universal child care for 0 to 2 years old and soon to 4 years old. And he did it with a very moderate centrist governor, which to me shows that this is not a progressive or a moderate issue. This is just a common sense issue. And when we get the right folks at the table, we can have that resolution. What do you see in your first 90 days, 100 days, 6 months as governor on affordability that you're going to be pounding the pavement to make sure it gets done?
Great. We've already talked about healthcare,
Yeah.
where affordability is just leading people to bankruptcy. Utterly unacceptable. The other area that I hear a lot about here in Maine is housing prices, not just in Maine, but around the country.
Yeah.
Housing prices are unaffordable. What that means is that families are paying 30, 40, 50% of their monthly income in rent. That means they are skimping on other things like medicines, food for kids. Utterly unacceptable in 2026. How do we get around that? We start building more and we make it easier for folks who cannot afford housing to start getting on that ladder through subsidies from the government. Another aspect of the high costs right now, electricity costs. It is time we have a circuit breaker so that folks aren't faced with rapidly escalating heating and electricity bills every single month. And then the last area that is an economic issue as much as a human issue, childcare.
Mm.
Young families cannot afford childcare, which means that one parent stays back from the workforce just because it's cheaper to stay home than
Yeah.
afford childcare. That is bad, and it's bad economic policy. It should not be the case in 2026. We can change that with more supply and actually giving childcare workers a living wage.
And I always point this out whenever someone brings up this question of childcare, when they're like, well, who's going to pay for it? And I point out that you're asking the wrong question. It's why are we, how can we afford the current status quo? Because if half the working workforce is forced to stay home because childcare is too expensive, well, then guess what's happening? You're preventing the taxation of a second income, and you're preventing even more revenue from coming in, which then goes back to the people that it's supposed to serve. So you're actually hamstringing yourself, squeezing out people who already don't have enough income, and giving children a worse experience. Is a perpetual vicious cycle. So I do hope you and I know you've spoken about that before, but I do hope that people understand when you talk about investing in childcare, it's actually a massive net positive for many reasons.
Exactly right. And, Qasim, I think the appropriate response to criticisms of a lot of progressive ideas, there was the criticism is, well, who's going to pay for that?
Yeah.
And I think the appropriate response is, well, who's paying for it right now?
Yes.
Right? When we talk about universal health care, people say, who's going to pay for that? Well, here we're already paying for it right now
Yep.
through administrative fees and denials and things. So we're just talking about a more efficient system. The same on childcare. Who's going to pay for it? Well, who's paying for it now? It's the spouse, often the woman who stays home and isn't earning money. That's how we're paying for it now.
Yeah, and it's one of those things where we can either pay for it through additional fees beyond our taxes, or we can simply pay for it through our taxes that we're already paying. So why are we gonna double and triple tax people? And I'm so glad to see a voice like you running in this space, because at the end of the day, if we don't focus affordability and the basic human experience, then what's the point of public service? And you bring a track record to that.
Well, that's exactly right. It's part public service, it's part delivering for people. The good news here is that Mainers are resonating with this message. I am up in the polls. I'm leading among the Democratic candidates by 5 full points. That is in part because of the relationship that I've already built up with Mainers, but it's also because even in this era of extreme polarization, what folks are looking for from their chief executive is someone who will deliver results. That is the track record I have, and that is what I will deliver as governor, and that's why I'm up in the polls.
I had a chance to visit Maine a couple months ago. I loved it. It's my first time there. I can't wait to come back and visit again. How can folks get involved in your campaign, your website, your donation link, all the stuff?
I'd be honored if folks would take a look at our campaign. The first and best place to go is to our website, shahformaine.com, SHAH for Maine.com. Please sign up for our emails and stay in touch with the campaign. The second thing, for folks in New England, we'd love to have you come up here and volunteer. And then the third, as you mentioned it, Qasim, we would be honored for any financial contributions folks could make, and you can do so from that website, shahformaine.com.
Nirav Shah running for governor of Maine, running a fantastic, people-focused, healthcare-focused campaign that, to me, I mean, I talk to hundreds of candidates every month, and Nirav, I'm super excited about your campaign because I think you're doing it the right way, and you always have a platform to come back anytime and talk about the next steps in your campaign.
Thank you, Qasim. What an honor. Thank you.